There we go. Welcome back. Modern Nurse Fest, day 2, day dose. Let's get started. Thank you for joining me live, or if you're watching the recording, thank you for being here. I'm so excited to be here and speak about somatic nursing. So let's dive into it. So what is somatic nursing? But before we get into that, let's talk about how that even started, right? So my name's Emily Knife. I am the founder of the School of Modern Nursing, which was created after I created the somatic nurse coach certification. And then the microdosing certification came along, and the microdose coach certification came along, and then all these other courses started coming. And I was like, I need a school to house this. And I've always wanted to be a dean for some reason, but I didn't want to climb that corporate institutional ladder, right? Because then you have to spend a lot of money just to get there, to have a lot of people that you don't want to deal with. So I was like, screw this, I'm doing a different way. I'm going to be a dean in a different way. And now I get to do awesome things and live my passion. So who doesn't want to do that, right? So I'm so excited you're here. We're going to talk about a little bit of passion, emotions, because that is in deep of what somatics is. So
Okay, we do keep losing her, right? It's not just me.
No, I was thinking the same thing, but
Yes, I'm having that problem too.
she'll be back.
They always come back.
all right, so let's go ahead and dive into why somatic nursing was created. Somatic nursing is about the nervous system. And if we look at the body as a whole, we'll see that our body is actually ran by our nervous system. Our nervous system is our computer. So, for example, let's just think about this in computer terms. Your hard drive is like your brain. All right. So, what happens when you get a virus on your computer? Just throw some things in the chat here. What happens when you get a virus on your computer? What happens? Anybody? Yeah, it doesn't work anymore. It crashes. You might have Windows pop up that's like virus, 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 and then take you some weird, crazy site, right? We probably all had that happen. And that's kind of what happens to our body when it gets overwhelmed, right? So in regards to the nervous system, when our body is getting overwhelmed, when our computer is getting overwhelmed with sensory input, whether it's external input or internal input, it's going to get overloaded and it's going to want to shut down like a computer, right? So, what happens when that shutdown happens? It kind of looks a couple ways. It looks like maybe in the words of, I want to end my own life. I don't want to be here anymore. I want to kill myself, right? That's the part of the computer that is like at its point of shutting down. And I've had my computer just shut down on me. And that's really what's happening with the nervous system within our body. So we're going to start thinking a little bit differently about the terms of ending one's life today, because we're going to dive into why that is happening. When the nervous system is so overwhelmed with things, it just wants to shut down. So we're going to talk a little bit about that too. But back to somatics, my journey up to this point has involved a lot of mental health care. And in regards to that, a lot of the treatment that comes with that is medication after medication. And then we'll give you some more medication. And then if that doesn't work, we'll electrocute you a little bit and maybe throw you into a room with nobody in isolation, right? So the treatment with mental health has gotten so extreme that we're not coming back to the nervous system. We're trying to treat symptomology, and with that symptomology comes more meds and more meds and more meds. And I was at a point that I was on so many medications that I was a complete zombie. I was not myself. And I was like, this is not right. Why is this happening to me? And I knew that I had to do something different. And I knew that there was a better way, just instinctively and intuitively as a nurse. And so on this journey, I got my yoga certification. I have a massage therapist certification. I have a somatic practitioner certification. So I have lots of deep body work and internal work that I've done to ultimately come up with the new field of somatic nursing. And when I first came up with somatic nursing, I remember telling my coworkers at a big box institution that I used to teach at, and they were like, "You're crazy. You just made that up." And I'm like, yeah, that's how all ideas happen. People come up with ideas, so they make them up and it comes into fruition. So even though you probably never heard the word somatic nursing, it's here and it's a field that's diving into nervous system care. So let's go ahead and I know, no PowerPoints. I'll make it easy on you guys. That was one of my rules here for Modern Nurse Fest is no PowerPoints at only 3 slides. But I'm going to break those rules just a little bit just to give you some more information. But I promise I'll get the screen off and we can have a little bit of fun here. So before we dive into reimagining, healing, the revolution, and the rise of somatic nursing, I want you to check in with your energy. We are energetic beings. I talked about this yesterday in the opening ceremonies. And we have an electric node in our heart called the SA node, right? It's always firing and it's making our heart beat. And when that doesn't fire anymore, then our heart's not beating, right? So we are electrical beings. We have electricity running through our bodies all the time. That's why you get shocked sometimes when you touch things because it's a charge. It's an electrical charge. Our nervous system is electric. It's sending messages all throughout the body. It's super cool. So we're going to dive more into that. All right. So real quick, go ahead and in the chat, I want you to write what you were on a scale of 1 to 10. So 10 being extreme energy and 1 being like you just want to roll over. And then 5 somewhere in between, like you're like, I'm good right now. I'm not like super energetic and I'm not super low. So go ahead and throw in the chat what you're feeling, what you're noticing in the body. I'm about an 8, 9. I'm going to go 9. And so let me hear where you're at right now. Yeah, we got a 6. Good. Focused. Love it. I know I'm bringing high energy and I'm hoping that kind of leaks onto you guys today. So as we go through this presentation, I want you to notice your energetic levels, your emotional levels, and where they're at, because this is going to be very interesting. All right. So before we dive into more of the presentation, I want you to check in with your breath. And so our breath is in direct relationship to our nervous system. When our breath is erratic, short, and shallow, our nervous system is also that. If our breath is slow and steady and deep, our nervous system is mirroring that. So it's really cool. A lot of the patients that I've been with in the hospital, before they get to the pain pill, asking for the pain pill, I would do some breath work and noticing with them. And in regards to pain, they would focus on the pain. So if we can divert the attention away from the distracting situation, whether it's pain or an external influence, then we can get that person's nervous system settled down. So at any point today, you can settle down your nervous system by just taking a deep breath or even opening your mouth really wide to induce a yawn. And that will bring you back to a homeostasis level. Okay, because we always want to be in that homeostasis level, right? And we've got a 9 today from Eileen. Thank you for being on here. Shout out to my mama. She is in with us, a retired midwife. She still teaches though. Amazing. That's why I became a nurse. So thanks, Mom, for being here. Appreciate it. All right. Let's go ahead and move on. All right. So what are you noticing when you see this picture here? When you look at this picture with your eyes are going to go ahead and decipher that, send the messages to your brain, and then your body's going to have a visceral reaction, whether it's emotional or sensational. And so what I mean by sensations, you might feel tingles, you might feel your heart rate increase, you might feel your salivary glands kind of get a little bit wetter. You might feel a lightness in the chest, right? You might feel a freeness in the belly, or the opposite we'll talk about here in a minute. But go ahead in the chat, tell me or speak out loud, show yourself here, and let me know how you feel about this picture. What's coming up for you?
Pure joy.
Yes, pure joy. I just saw the extra fingers. Nona, yes, you win a prize. Thank you for seeing that. I will send you're getting a free PDF actually for ChatGTP. So this was created by AI. And what the heck? How crazy is that? Is this our future? Is this what the COVID vaccine is going to do? Who knows? We don't know. But let's go ahead and focus. So we said it was giddy, joy, excitement. Eileen said it was joy as well. And yeah, like it's happy, right? Besides the extra fingers, maybe he's waving his hand really fast. But yeah, it's invoking excitement, joy, and happiness, right? So our visual aspect gives us a lot of information. So say you're watching the news all the time. The news has a very low frequency. Remember, we're energetic beings. We want to be up in a higher frequency state. And when we're in a higher frequency state, we are in a state that we're not letting others predict our future or letting others dictate who we are, right? So when we're in a low energetic state or being bombarded by low energetic advertising, news, pharmaceutical companies, social media, we are constantly taking that into our nervous system. So if you're watching TikTok and you're watching videos of cats and dogs playing and people celebrating, that's going to invoke joy feelings into the body, right? And that's going to make you feel really good, probably about yourself and others. And you're going to want to go do things in the good, do good things in the world. But on the alternate side, let's go ahead and move here. Tell me, what does this feel to you? What does this picture invoke inside of you? And what's interestingly enough, you can add it in the chat. What is this making you feel? If you've ever experienced a fire or been in a fire, this might invoke even more feelings because of your past experiences. So we are humans and we build upon experiences, either internal or external experiences. And at any time, we can change that experience to look very different. So we're going to talk about that too as I dive into dialectical behavior therapy. But we've got sadness due to the death of the forest. Absolutely. I feel like I can hear the trees screaming in this. Fear, helplessness, hatred, oppression, angry. Whew, even just saying those words, I feel low. I feel low. And a lot of what we're seeing today here around the world is fear. And it's very heavy. Actually, our rates of kidney stones have increased since COVID. And if we look at Chinese medicine, fear is directly related to the kidney. So if you're having issues with the kidney, whether it be UTI, kidney stones, I want you to check into your fear and what you're so fearful of and really dive into that. All right. So this picture invokes a lot of those not so good feelings, right? And seeing this over and over might make you feel kind of crappy about yourself, crappy about others, and make you fall into a state of, let's say, deep sadness, or also known by the DSM-5 as possibly depression, right? So if we're seeing this stuff all the time, what is it doing to us? What is it doing to our kids? What is it doing to us? And we can see that it's really played a big part as we've seen the suicide rate increase dramatically, along with depression and anxiety in America. So here we go, blank screen. What are you noticing? What are you noticing on this blank screen? What are you noticing in your body? Go ahead and throw in the chat what you're noticing right now. Yes, Taylor, I love that. Lost. Very interesting. Abandonment, anxiety. Ooh, no direct, you guys, wow. Lack of a leader, no direct, it's just blank, right? It's like, where does our visual aspect go? Opportunity. I can feel this. Yes, coming the opposite way, right? So it's really what we're seeing this. Yeah, no, I see. I hear you. I was a psych nurse too. I get it. Yes. And staring at a blank piece of paper, especially when you're in that mental health facility, it's like daunting because it's like, wow, I need direction, right? When you're in that state of fight or flight. So as you can see, when we're in a state of fight or flight, our bodies are going to be looking for external things to grab onto. Our nervous system needs direction, right? So when we're in a state of fight or flight, which nurses are pretty 24/7, if you're working bedside or if you're working in a very stressful environment, you're in fight or flight. So your nervous system is like, that's what it looks like inside. It's like, and like your sirens are going off, but you don't hear it because you're not even connected physically to your body anymore because you're in a state of disconnection, right? So when we're in a state of disconnection, like I showed you that blank piece of paper, we have different views. And I've done that before in several other speaking events, and I get so many cool answers because it's all varying based on your past experiences. Maybe you've seen a blank piece of paper before and you're like, been told to draw something and you were so fearful, you're like, I can't draw, I can't do this, right? Or maybe that blank piece of paper was put in front of you and somebody said, give me your best ideas for your business, right? So it depends on our internal experiences that we've accumulated up to this point, right? So, like I said, going back to the news, if we're constantly watching that, that's going to affect our body. That might even cause disease and disorder in our body. And I can tell you, mental health wise, getting away from that has done me wonders. I am not in that fearful state anymore. I'm not reaching for fearful things. I come back to joy, gratitude, and abundance and happiness. And I know that that is our birthright. That's how we like start out. But then we've given all these other external circumstances to build our own experiences, right? And it comes back to our nervous system. So we've given a blank piece of paper. What do we do with that? Right. So we're always looking for something, especially when we're in a state of fight or flight, to fill or help us kind of relieve that pain that we're experiencing in our nervous system. And so, for one example, including myself and some of my clients, the need to go back to school to get more certifications and more degrees comes from a dysregulated nervous system, usually. Usually you don't go back to school because you're like, I want to go back to school for 4 years and become a doctorate nurse because I'm going to get paid $300,000 and I'm going to have the way less stress job ever. No, that's not how that works. With more degrees and more money spent, more debt, you get more stressed. So climbing the ladder might not be such a good thing when we think of it in regards to our nervous system. And coming from a disassociated state when making decisions in a flight or fight state is going to be impulsive and isn't coming from the present moment. Usually it comes from a place that we're trying to reduce pain. So adding more stress helps us disassociate from what we really need to focus on. And usually we need to focus on ourselves and what we're dealing with inside. So a lot of nurses that I coach, a lot actually, either go back to school or get a certification when they're going through a hard life experience. And I did this myself. When I had two under two, I went back to nursing school. And then for the next 10 years, I went to school from an LPN to an ADN to an MSN and then to a bunch of different certifications because I was disassociating from myself. And I wasn't, listening to myself. I wasn't asking myself, what do I want? I was answering external circumstances, people that were like, hey, Emily, you should go back to school. That would be amazing if you got your doctorate. How cool would that be? You could be a professor. Sounds so cool, so shiny when I was in the academic institution because it's like climbing that ring that rings up there. And I'm like, I want that. I want that. But I don't, because when I've stepped away and come back to a regulated nervous system and try to make that decision again, and seeing all of the things that's involved in that, I don't want to do that. And so I urge you today to start coming from a place of a regulated nervous system making decisions rather than this fragile, vulnerable nervous system that can be compromised at any time by people that want to sell you stuff, right? That's why salespeople are so good, because they use psychological tactics that get deep into our nervous system and bring up emotion or evoke emotion, right? So I kind of just took you on a little bit of an emotional journey by showing you different pictures. Now imagine you're seeing visuals all day long, right? Including myself in front of you right now. So we're going to go ahead and raise the energy because I just took it down. So now we're going to we got it for 6, 5, 4, 3, 2, 1, and then go crazy. Just pump, 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 and stop. And notice how your body feels. Go ahead and throw in the chat what you're noticing right now in your body. Right after just doing that for 5 seconds. What are you noticing? What are you noticing in your arms? Maybe your heart rate, got a little smile on your face, right? Feel a little bit more energetic. So if you're hitting that 2 or 3 slump today or whenever, you can just do that. Pump your arms up. We are pumping up. We're creating fullness in ourself. If we looked at people that are depressed, usually they create themselves to be small. They're constantly like this, and they're this, and they're covering, and they're this. But when we're expansive and we're happy, we are open. And we create our emotion in our body at any time today. You can change your emotion. When I learned this trick from dialectical behavior therapy that I went to for 21 months as an outpatient, it changed my life. When I knew that I was in control of my emotions and not other people, it absolutely changed my life. And that's what we include in the Somatic Nurse Coach certification. We do a whole thing about dialectical behavior therapy because it's the one therapy that actually helps and treats and navigates the nervous system through mental health. Right. So if we had a lot of people that were regulated around this world, we wouldn't have people shooting at each other or killing each other or hitting people, domestic violence. Right. So it's a really big problem, and it comes back to the nervous system. We have so many different doctors that are in so many different specialties, and it all comes back to the nervous system. Back in 1920, we had one doctor. It was a family doctor. They treated everything. Right? But insurance companies were like, hey, we can make a lot of money if we create specialties. You know what this can do for us? I can get a new Lamborghini. That's how that works. It's a business. We've got the government, we've got big pharma, we've got the institutions that run under that, as well as universities and nursing schools. So we're not getting the full story. So that's why I created the Somatic Nurse Coach certification and the field of somatic nursing, because it comes back to the nervous system. The nervous system is the root situation for any disorder disease. If you have rashes all over your body, it's because your nervous system's out of whack. If you're having cardiac malfunctions, it's because your nervous system is out of whack. If you're having digestive issues, nervous system, immune system is directly connected to the nervous system, along with the endocannabinoid system, which we learned about yesterday. So it's really important to understand that it all comes back to the nervous system. All right, so I just got you to raise your energy and you changed your emotion in an instant. So I want you to, again, check in with yourself. Notice what you're feeling right now, because I just said some things that might make you cringe or go, wow, actually, yes, now I see it, right? So let's go ahead and, I told you I'm not gonna bore you with the PowerPoints, but let's go ahead and use this next slide. Okay, I presented at the International Conference for psychedelic psychiatric nursing. That's the psychedelic one is coming up. And I presented this presentation. And so let me just give you a little backstory on this real quick. I used to teach for a big box university, very well-known teaching university they had great people in there, not saying that they didn't, but their mission and their values didn't align up with what I wanted to do, right, in life. And that's okay. That happens in jobs. You should be interviewing the job. They shouldn't be interviewing you. You're going to go work there for them 40 hours a week, right? You should be interviewing them. So make sure wherever you go that it is a good fit for you. So suicide is a huge problem. Ending one's life is it's horrible. It's horrible. And having somebody come to you and saying that they want to die or they want to kill themselves is they're at their bottom low. Their nervous system is about to just turn off, right? So it's been a very huge problem, but we've seen it increase dramatically. And I'm not saying dramatically, I'm saying traumatically, because people's lives are being changed, families' lives are being changed because of us not treating suicide like we should be. Throwing medication at it when it's a nervous system problem is not helping. We can treat different things like depression, sometimes works with medication, or anxiety, but the longevity of that, we are just covering up symptoms. So when we take that medication away, you're going to get the anxiety back. So obviously it's rooted in the nervous system, and we need to figure out why you're having that anxiety. And that's the biggest part of the somatic nurse coach certification, is we figure out the why, and then we dive in. We dive in, right? And so not only you as a nurse, you get to do this through the certification, but then you get to share that with your clients as well. But it's the leading cause of death for adolescents. Like, what the heck? This is a problem, right? And it's due partially to social media and what these kids are seeing in front of them as well. Anxiety disorders are the most common mental health disorders among children and adolescents. As early as age 6, kids are being put on medication. 6 years old, 6 years old. American kids and teens are more likely to be on multiple drugs, up to at least 5 or 6 teenagers right now, 5 or 6 drugs. 9.2% taking 2 or more, compared to 8.5 of young people in the Netherlands and 5.9 of those in Germany. So in the United States, we are a drug run business. If you travel the world, you'll notice that this is not a huge thing in other countries. In fact, other countries don't have commercials for drugs. They just don't. The DSM-5 today has nearly 300 mental illnesses. So if there's like something wrong with you, like if you spend too much time on social media, you probably have some sort of itis. So insurance companies come up with these diagnoses when they match a drug that can treat or help, or a treatment that they're like, ooh, that's a good protocol. Let's go ahead and use that to treat this person that wants to end their life. That sounds good. We're going to create an ICD-10 code. We have a drug. It's all this great business, right? But what it comes down to is the DSM-5 in 1952 only had 106. So what's going on? What's truly going on here? Are we causing the mental health crisis? I did this awesome study with students, over 1,331 students at an institution that I used to teach at. I used to teach several sessions a week to nursing students and faculty and staff, and up to about 50 to 80 people would come on at one time. And we would focus on different somatic techniques, dialectical behavior therapy, awareness, and energetics. And these are the results. So we can see here, if you look at the start, this is the student. So their anxiety, these are nursing school students, by the way. So burnout does happen in nursing school, which is crazy. If we look right here, this is the start. They're at like 90. About the middle, they were at a 69. And then at the end of the 12 weeks, it went down to a 17 using these skills. Depression, they were high. Nursing students were, it was super high. I was kind of surprised. 77 said that they were depressed. In the middle, it came down to a 49, and then down to a 13 at the end. They were so aware of their emotional state. They were like, I'm able to get out of this sadness. I can change my emotional state at any time I want. So when they started to learn that, things started to shift. Suicidal thoughts, a whopping 51% came in with either past suicidal thoughts or even current suicidal thoughts, right? And suicidal thoughts can look a lot different depending on the person. And the reason why I paused with that, because I wanted to focus on it's a nervous system dysregulation. That's why we have that thought that we want to end our own life. The nervous system wants to shut down, right? And so instead of saying, I want to end my life, these students started to learn that they could say, instead of saying, I want to end my life or I want to kill myself right now, I am so overwhelmed right now. I need help in this area. I am so overwhelmed right now. I just need to take a break. I am so overwhelmed right now. I need to call my mom. I am so overwhelmed right now. I need to take a break from nursing school and just take a couple months off, take a term off. I am so overwhelmed right now with all of the exams and all of the coursework that I just need to go do something fun. And this is what we have. We have a whopping 5 out of 51 that still had them, but not as much. Holy crap, guys, come on. Like, this is the results from what I've been doing for 3 years of collecting data with just nursing students. Can you imagine what if this world learned about somatics? We taught somatics in school. School nurses, here's a rant, school nurses are underutilized in the mental health and well-being for students. We shouldn't have counselors that are registering kids for classes, also doing suicide assessments. That should be saved for school nurses. School nurses are a huge missing opportunity for mental health in our education system. They should be the first person to see a student if they are having a mental health crisis, not a counselor that is not trained in crisis intervention or therapeutic communication. It's crazy. I have to get a drink of water because I can feel it in my throat, right? That's us speaking up. You can start feeling stuff in your body. Yes, yes. Thank you for, I'm reading the chat right now. Yes, emotional intelligence is a superpower. Yes, absolutely. Yeah, more information on the study. Absolutely. Thank you so much. Yeah, I presented this to the Big Box Institution and they didn't want anything to do with it. They were like, we don't, that's great work for 3 years. We don't care. And that's when I quit. That's the day I quit, when they said that.
Thank you.
Yeah.
I know.
So it's, it's really important that we understand, that it's the nervous system. We look at identifying emotion. I know it's spelled wrong here. Identifying emotions. We have 99 at the end. We came in with a whopping 18, not knowing what emotions were, how to identify them, right? Because we have more words for emotions than just sad and happy. There's a plethora of emotional words, and you learn that in the certification for somatic nursing. Self-regulation, holy crap, that is so valuable. If you have patients throwing food trays at you and calling you all sorts of words under the sun that are a little defeating, if we have self-regulation, we can understand that that has nothing to do with us and that we can act accordingly. If I have no self-regulation and a patient throws a food tray at me, I'm about to throw that food tray back at that patient. If a patient calls me a very horrible name, I'm about to unleash the fury and call them names back. Nurses sometimes are not in regulated states. Again, because we are in fight or flight all day long, it's hard to come back to that self-regulation when you have hit the tipping point. You've done a 12-hour shift, it's 6 p.m., and a patient decides to throw a food tray at you. And you've been patient all day long. And all of a sudden, it just comes out, right? And so this is where self-regulation comes into play. And it not only bleeds into your nursing career, it bleeds into your life. And it helps you live a better life. Instead of throwing up the middle finger when you get cut off in traffic, you're just like, yeah, it's not about me. That person probably has to poop really bad. Okay. That's what I say to myself. If somebody cuts me off, I used to get so frustrated. I would be like, oh my God, why are they cutting me off? But now I'm just like, man, that person probably has to poop so bad, or that person has something going on that they feel the need to cut in front of me. And I'm just like, they have to poop. And now my kids, even when people cut us off, they're like, man, mom, those people really they might have really bad diarrhea. I'm like, yeah, they probably already pooped themselves. Like they are going so fast, right? So, like, let's make a light out of life. Life is a game to be played. And so you get to pick your avatar however that looks to you. So if you want to be a defeated, depressed victim person, that's your choice. If you want to be a joyous, abundant, filled with gratitude and know that the world is abundant and full with possibilities, and that you can live your dreams, that's a whole different story. You get to pick and choose your emotion. End of story. Any questions on that research that I've done? This literally was a survey monkey at the beginning of the 12 weeks, the middle of the 12 weeks, and at the end of the 12 weeks, they answered the same 10 questions. And I gathered this data from that. Over 1,300 nursing students participated, as well as staff. And that was really interesting. So yeah, so I did try to get it published. So when I went to the big box institution, they said because I didn't go through all the red tape, although I was an independent contractor collecting my own research, that I wasn't allowed to publish it. But I will probably be publishing it soon because there's always ways around things, right? There's always a back door. That's what the hippies say. Yes, in workplaces, just reading over the chat here, because the lack of empathy in medical institutions is pretty astounding. Absolutely. When doctors are referring to patients by their room number, that's when I get up and leave. That's not okay with me anymore. All right, awesome. Let's move on here. We've got 11:42. Perfect. Okay, work with our tools. So what do somatic nurses do, right? You're like, Emily, just get to the point, right? So somatic nurses, we dive into a bunch of cool things. So it's an 8-week program. We meet twice a week for an hour at each time. We do live demonstrations. We learn. I don't like PowerPoints, although I have one up right now. It's very interactive because that's what somatic nursing is. It's interactive with somebody that has a dysregulated nervous system, and we're going to help them get back into homeostasis because that's where we should be at all the time. So we dive into neuroscience, and not the neuroscience that you learned in nursing school. You know, those 12 cranial nerves that you had to memorize for the NCLEX. Yeah, forget about those. We don't even know anything about that in regards to the nervous system. That has nothing to do with the nervous system. It's just some cool thing that you have to memorize, like the face with the numbers on it to help you pass the NCLEX. So we're going to dive actually into real neuroscience, understanding the actual brain's role in mental health. And why is this a problem? Why is this not being taught? Because in nursing school, in the mental health lecture that I used to teach, that I could not do anymore because it was hurting my soul, because I knew it wasn't the truth, that serotonin was made in the brain. We were telling nursing students that serotonin primarily is made in the brain and that all mental health is a brain problem. But it's not. It's a whole body problem. So why aren't we teaching this? Well, because we have the umbrella of the government, big pharma, and the institutions underneath it. So that's why we're not teaching the truth, because nurses are taught to hand out medications. They're not taught these other modalities and practices that can actually help people get better and not need medication. Because if we did that, then somebody at the top is going to lose their Lambo and it's going to be a big problem, right? Or their $1 trillion house that they live in, while people are dying because they're just keep adding more and more medications. And if you join me tomorrow, I'm about Super Patch Company, which is just on the nervous system. So 95% right. So if you're depressed, it's probably because you're a standard American dad. back at it. I apologize for that brief interruption by our wonderful sponsors, AT&T. So we are diving back into why somatic nursing. So let me go ahead and bring back up that screen here. So we are looking at the truth, and we are teaching people the truth about their nervous system and how we can help heal the nervous system through neuroscience. We also look into dialectical behavior therapy, which I did a stint of, and I love DBT, which was created by Marsha Linehan, who was experiencing a whole heck of a lot of mental health stuff and was just not getting the results she wanted. So she created dialectical behavior therapy. She made up dialectical behavior therapy, like I made up somatic nursing, right? So it's offering practical skills for managing emotions, interpersonal relationships. So it helps with how to get what you want, how to talk to people, which people just don't know how to do these days, and crisis self-intervention. So when your nervous system is really out of whack, you know how to get back to a regulated state without ending your life. Like these are the tools and solutions, and I've seen them work not only on me, but on so many clients that I've had that have come from a state of chronic suicidal ideations or chronic suicide attempts. They are no longer having those thoughts because they thought challenge. So I dare you today to thought challenge yourself. And what that looks like is when a negative thought arises, whether it's like, I'm stupid, I'm ugly, I can't do that. I want you to thought challenge that and be like, what? You're telling me, like, I want you to talk to your ego. Like, you're telling me I can't do that? Watch me. Watch me do that. And I have this conversation all day long with my ego. So start, if you don't already talk to yourself and people are like, who the heck is she talking to? Start talking to yourself. You are your own doctor. You know what you need if you just take a moment and listen. Okay. All right, as you can see, I'm very passionate about this because it works, and I know it works. Somatics is exploring the connection between physical sensations and emotional states, empowering humans to learn about their own body. We go to school for 18 years and never learn about our own bodies, besides sex ed and how the cells are so cool in biology. But other than that, we know a few things from anatomy and physiology, but that's about it. We don't learn about emotions, the nervous system. We just don't, because they want you to not know the power that resides inside of you. Because when you're in a regulated state, you can do anything you want. We're also looking at plant medicines and somatics, from psychedelics to other plant medicines such as cannabis, and non-pharmacological tools such as the super patch, which you also get privy to in the somatic nurse coach certification. So we have lots of cool supplementals in there that can help you with clients. Okay, any questions about the tools that we use in somatic nursing? Just speak up and speak out. All right. So why become a somatic nurse? Have a little friend come in here with me, a little bumblebee. So the revolution of nursing, to become a somatic nurse, we start in January. Our cohort starts in January. I cap it off at 15 to 20 people because I want to work individually with you. You get one-on-one sessions with me as well through the weeks. So if there's a concern, if there's something that you're dealing with in your actual life, we will do a coaching session and I will coach you somatically through that so you can see what that looks like on the other side. So it's a super cool program. It's very interactive. We go for 8 weeks, 2 live sessions a week, and a community for a lifetime. So once you get into the program, you can then discuss anything you want with all of the students and graduates within the program. The opportunities for somatic nurse coaching is a little bit different than a traditional nurse coach. The reason why I say that, nurse coaches look at whole body wellness, but they don't really dive into the mindset shifting, the emotional or the nervous system awareness with the backing of a DBT skill set. I've also included my DBT workbook into the certification, so you have a plethora of worksheets that you can use with your clients. So lots of cool worksheets, lots of cool videos, and so many amazing resources in the program to help you along. Not only is it a program that's different than the usual nursing certifications that we see in the nursing world that don't give us any ideas of how to work with that or how to make money on that certification, right? Like you get a labor and delivery nurse certification, you're like posting on LinkedIn, you're like, yay, I got a labor and delivery certification. It's like, okay, well now what? Did you get a raise? Probably not. Like what? Why did you even get that? Like it just signifies like you know your shit, basically. right? So it's just really interesting how nursing certifications doesn't really apt you to make money with that certification. Like getting a certified nursing education certificate doesn't do me really any good, except it puts a few letters behind my name, and it might look good when I go apply for a job in an institution that I don't want to work for. Right. So come back to like what you're good at and just go with it. Stop reaching for all these certifications. We give you a business module as well to get you started. So we show you how to set up a membership, how to set up one-on-one, how to set up group coaching, how to set up a blog, how to set up your own courses, workshops, and more. I have a somatic nurse coach right now. She is creating a menopause program. And so I love that because it's a niche that is huge right now. I don't know about you. It's probably not showing up on your page, but I'm around that age that's starting to creep up. So I'm seeing it everywhere. And I'm like, am I menopausal? Again, it's that nervous system connection of what we're seeing. If we're seeing that menopause in front of us, I can probably put my state of self into an early state of menopause. If I'm constantly looking at people that are depressed around me, and around the 5 people that I'm around the most are depressed all the time, then I'll probably be depressed as well, right? So it's that continuous notice of you are the top 5 people that you're around. And that's why I love the entrepreneurial space on LinkedIn, because I get to meet so many cool people that want to collaborate rather than compete. So that's what I love about that. Okay, any questions about the somatic nurse coach certification? Happy to answer them here as we start to wrap up. If you want, this is a cool like little QR code that you can scan. This will get you on the wait list. So I will be sending out information after Modern Nurse Fest to anybody that signs up on the wait list, the information about the program, and also any payment options that you want to do as well. So we work with every single nurse or nursing student. We have nursing students that are in our program as well. We work with you because we value this and we know that it is an extremely needed person, nurse realm that people need. You can not only become a somatic nurse coach, you can just take this into whatever your current practice is. So if you're a labor and delivery nurse, you're an ICU nurse, you can use these skills with your patients, and it's not out of your scope of practice because you are just educating. We are educators as nurses. So you can educate on anything. You're not telling them like, hey, this pill is going to be great. You should take this. I'm going to hand it to you right now. I'm going to shove it down your throat. You are not doing that. You're educating. And as nurses, we are educators. All right, so that's that. All right, any other questions before I go to the review page where you guys can review my talk today? Any questions here about somatic nursing, about my journey? Any questions? Go ahead and put in the chat where you're at right now in the world. I know we have some people joining us from Africa today, and I got a message from Germany. So we have lots of cool nurses from around the world, and it's not just in the United States that these things are happening. Nurses are burnt out everywhere, everywhere. Nurses in India get paid like $5 an hour. It's crazy, the stories I've been hearing. So we've got people from Iowa, Ohio, Florida. Yes, thank you for being here. Dubai, woo woo. We got Dubai in the house. Sarah, NYC. We got 2 people from NYC. Dang, y'all should get together up in there. NYC representing up in the house today at Modern Nurse Fest. So again, if you have questions, you can join the wait list. I really appreciate just hearing some feedback. Dr. Fiera Laurent showed this yesterday, and I was like, I'm doing this too because this is so cool. And so I went ahead and put 1111. It's a manifestation number for new beginnings. And so you can scan that QR code with your magical phone, and it will take you to a page that you put your information in, and then you can write whatever you like about this presentation. And please let me know what you want to know more of. And if that is a question, I will reply to you and give you an answer or somebody that can answer that for you. All right. Thank you so much again, everybody, for attending. We're going to end with just a little bit of breath work here before we hit the 12 o'clock hour with Sarah Garbier from Dubai in the house. So let's go ahead and check in with our breath before we tap into our next presentation here. So close your eyes. You can see the energies coming down. I get into my meditative voice. I have lots of different voices. This is my meditative voice, my yoga voice. Enjoy it. Go ahead and close your eyes. Soften your gaze, look down at the ground, and take a moment to relax the shoulders down and away from the ears. Place your hands on your lap. And I just want you to bring a smile to your face. Because when we're in the present moment, everything is absolutely just perfect. When we're here now, what is a better time to smile? So bring a smile to your face. It might feel weird if you're forcing a smile, but bring a smile. You can even like laugh a little bit. Just bring in some emotional activity. Yes, got some laughter. I love it. Yes. And then go ahead and check in with your breath. If you want, you can bring a hand to your chest. Just notice your chest rising and falling. And breath is such an important, awesome symptom of letting us know we're alive. Because when we're not breathing, it's the opposite, right? So we can breathe and be alive today. Go ahead and take a deep breath in through your nose. Raise your shoulders all the way up to your ears. And as you exhale, let it go. We're going to do that 2 more times. Inhale deeply. Bring your shoulders all the way up to your ears. Inhale. And then good. 1 more. Really good this time. Bring your shoulders all the way up. And thank you so much for being with me today and this weekend. You guys rock. I couldn't have done this without you. Obviously, it would be really weird just talking to nobody. So thank you for being here and showing up not only for yourself, but for your nursing career. This is going to change your life this weekend. I hope you learn a little bit or a lot. And let's go ahead and we'll see Sarah. So Sarah's coming on here at 12. And we look forward to seeing you in there. All right. Thanks, guys. Have an awesome, awesome day. We'll see you soon in about 2 minutes.